Hello, welcome to my self-healing channel. Today we are here to talk about mental health, especially self-healing. This is our virtual counseling session number 4 on how to manage depression. So if you watch it until the end, you're going to walk away with a skill called visualization exercise. Using this skill, you can be more physically, emotionally, and mentally stable. So stay tuned. This is our virtual counseling session. I'm going to facilitate our session as if we are having a conversation, as if we are exchanging ideas here. So let's dive in. Alright, let's review your progress. How would you describe your mood lately? Maybe looking at past week or past 2 weeks. Can you describe that to me? And I'll give you time here. We're using an inventory called PHQ-9, Patient Health Questionnaire 9 for depression. This inventory asks specific questions about symptoms of depression. So by filling out this inventory on a weekly basis, we're able to compare a score, we're able to monitor your progress. And there's a link to PHQ-9 in down description box, so please take your time to fill it out. Let's compare your score with your previous score. Is your score higher or lower than your previous score? Next question is, what has been helpful or unhelpful in terms of taking care of your mental health? I'll give you time here. In our last session, we talked about cognitive diffusion techniques. How was your experience diffusing yourself from your mind and acknowledging your thoughts from a distance? How did you use this technique? Where did you use this technique? Who did you use this technique with? Take your time to answer my questions. Alright, so after using this cognitive technique, what emotional and physical change did you notice? And next question is, what change did you notice in the overall quality of your thoughts? There are 3 areas: the pace of your thinking process, the order of your thoughts, and timeline of your thoughts. So after using cognitive techniques, what change did you notice in your thinking process? And let's take a moment to reflect on the overall quality of your thoughts. Moving on, let's talk about your progress. How much progress did you make on a scale of 0 to 10? 10 being the most progress you can make, 0 is no progress. And can you tell me the reason why you choose that number? And I'm also curious as to why your number is not lower, which means if your number is 5, why not 4? And next question is, what can you do to make more progress? What are the actionable steps that you can take so that you see more progress in next week or next 2 weeks? Alright, let's cut to the chase. Today I'd like to present to you a visualization exercise called container exercise you can use along with the cognitive techniques. This visualization exercise is serve as an internal resource for you to feel relaxed, feel distracted from anxiety and depression. I like to say that this is our internal resource. We get to external resources such as talking to friends or going to groups or reaching out to your mentors or talk to your boss when we feel depressed. Those are the external resources that we have. And on the other hand, we want to build internal resources so that we can tap into these resources internally when we feel depressed or anxious or even like stress. I am EMDR trained therapist. EMDR is the evidence-based therapy for processing trauma. And there's different phases in EMDR therapy, and one of the beginning phase is the perforation. And during perforation phase, my job is to help client build internal resources for them to stabilize their mental health. So one of the tools that I present to a lot of my clients is container exercise. When we feel depressed, it's very common to see this chain of negative thoughts such as I'm helpless, I'm worthless. With that thinking process, we start feeling physically depressed. Some people say I have a void in my heart, I have a pit in my stomach. So those are the physical sensations that people experience when we feel depressed. So this container exercise is very helpful in terms of putting a break or bring awareness into that chain of negative thoughts and that physical sensation associated with depressive thinking. Here's how this container exercise can be helpful in a moment of depression, and there are steps to follow. So when I notice having this depressive thinking process or start feeling depression in my body, I bring up the image of this container that I created to the forefront of my mind. And then I think about the object or item symbolizing that depression or depressive thinking process, and then think about the item and grab that item in my imagination, put it in my container and close that container. Then I'll put it somewhere it's far so that I notice mental distance that I have between myself and the container. Because with that mental distance, I start noticing that, oh, you know what, I'm safe. I want to pause here. This is really important. Healing process is up to your preference, up to your imagination. So we want to be creative. We want to be flexible with the way we cope with our emotion, the way we process with our emotion. I want to stress the purpose of the container exercise. The purpose of container exercise is not to remove that problem. It's not to erase their problems in your mind and body. The purpose of container is to hold the emotion, hold that thoughts temporarily, so that with the mental distance you can stabilize yourself, and when you feel ready and stable, you can go to container and start processing whatever in the container. Does it make sense? For example, I got into a car accident and I start having distressing thoughts about the car accident, and my client showed up. So I use container exercise to put my distressing thoughts away so that I can focus on my client. Does this give you an idea where you can use this exercise? Alright, let's get into practice. I want to help you make your own container. First, how big is your container? Your container needs to be big enough to hold that emotions, hold that thoughts, or people, or situation. So my container is about the size of my room. Your container needs to be very sturdy, very strong. So my container is made out of steel. So what is your container made out of? What kind of material would you like to use? So think about that here. Is there anything you'd like to add to your container so that it is more safe and safe? For me, I put a security guards around, and there are guard dogs, and there is a facial recognition machine. So use your imagination to make your container completely safe and secure. Remember, there's a two-way system. Put things in, hold it there temporarily, and you can take it out when you're ready to process, when you're ready to problem solve. Alright, let's practice together. So I want you to sit comfortably. I'd like to sit upright so that my body is stable. And I want you to take your hand, put it in your chest, because our chest area, our core area, holds a lot of emotions, holds a lot of thoughts. And I want you to close your eyes. I want you to visualize your container again. And I want you to really observe the color of your container, the size of your container, the things you added to your container, the materials that your container made out of. So really notice that. So now I want you to think about something that you want to put in your container. It could be some distressing thoughts, some overwhelming emotions, situation, people, some future scenario. Let's think about that, and I'll give you time here. Now I want you to think about an item or object that symbolize whatever you want to put in your container. So for me, when I think about my distressing thoughts, the boiling water symbolizes my distressing thoughts. So in your mind's eye, I want you to visualize that item, visualize that object, symbolize whatever you want to put in your container today. During this exercise, make sure your hand is on your chest and your eyes are closed, fully or partially. And I want you to visualize you grabbing that item or object, put it in your container, and make sure you close it and lock it and secure it. So let's visualize that action that you're taking. Grabbing the item, put it in the container, make sure you close the container and lock it. Visualize that, notice that. And I'll give you time here to really notice that action that you're taking. Now I want you to think about a place you can put this container away safely. For me, I like to take this container in my imagination and drop it at the bottom of the lake near my house, so that I have at least 2-mile distance between myself and the container. So I'll give you time here to think about a place you can put your container away, and make sure you know this place so that you can get to your container when you feel ready to process it. So I'll give you time here. Alright, you've done a great job. So how does it feel now? Maybe you can scan your body from head to toe. Make sure your hand is on your chest, and to see any change or shift that you notice in your body with this mental distance that you have between yourself and your container. Let's observe that. Let's take a moment. There we go. Notice that. And with your current physical state, how are you feeling emotionally? Can you describe that to me? Again, take your time to observe your emotional state. And I'll give you time here. Right now, I want you to slowly open your eyes. Bring your attention back to the room, wherever you are. And let go of your hand. There we go. That's the end of the exercise. Alright, how was your experience with the container exercise? Did you feel better? Or did you feel worse? And can you tell me what was helpful and what was not helpful? I'd like to know your observation with this exercise. Like always, I encourage you to practice this exercise in a neutral setting or neutral mood first, so that you build mastery, you build tolerance with this exercise. It is important to build mastery and tolerance gradually. What I mean by that is increasing the difficulty with this exercise. Maybe you can sit in your room and practice this exercise, and then later you can go for a walk and think about this exercise, and then later when you watch TV you can practice this exercise. It's about building that dual awareness of what's happening outside and what's happening inside. I'm very curious about your progress, so please leave a comment about your progress, or if you have any questions or concern, please don't hesitate to leave a comment as well. I hope you found our session helpful and valuable, and it is your responsibility to heal yourself because you deserve good things. Take care of yourself and do your healing every day. I'll see you in our next session.